And hello again from Fox News in Washington. Well, it's been another tough week for Obamacare, with continued problems on the government website and growing outrage over the hundreds of thousands of people whose policies are being canceled. In fact, healthcare.gov was down again for repairs overnight for at least 12 hours. But are these just bumps in the road or signs of fundamental problems? We brought in two experts to debate what's really going on. James Capretta is a healthcare expert with the Ethics and Public Policy Center. Dr. Ezekiel Emanuel is one of the architects of Obamacare and vice provost at the University of Pennsylvania. And gentlemen, welcome to Fox News Sunday.
Thank you for having me.
All right, so let's start with that pledge from the president when he was trying to sell Obamacare. Here it is.
We will keep this promise to the American people. If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period. No one will take it away.
But it turns out millions of Americans are not able to keep their plans. They're losing them. Florida Blue has canceled 300,000 people. In California, 280,000 policies have been canceled. In Oregon, 150,000. Mr. Capretta, the White House now says, its explanation is, well, that pledge only counted until the health care law was signed in March of 2010, only for policies that were in effect before then. And anyway, these policies are lousy.
Yeah, well, there's two things to it. There was no extenuating circumstances when he said you can keep your plan. He didn't add a clause. It was period. In fact, he said clearly you can keep your plan. He said it once. He said it 1,000 times. This wasn't a minor pledge. It was central to passing the law. It's sort of like President Bush saying no new taxes, the first President Bush saying no new taxes back in 1990, 1988. He broke that pledge, and at least he had the honesty to tell everybody he was breaking the pledge. The president actually pledged this and has never really admitted he was going to break it. There's millions of people who are going to lose it, at least 15 million, including people in the small business community. They're talking about the individual market now. Many small business people are going to lose their plans, too.
All right, we're going to get to that, but let's stay with the idea of the pledge, because Dr. Emanuel, the Wall Street Journal reported this weekend that you, in fact, were part of a debate inside the White House at the time about whether or not this claim, you can keep your plan, you can keep your doctor, was misleading. This week, let me just ask the question. It'll be a question mark, and then you can answer. Whether it was misleading. On Megyn Kelly's show this week, you blame the insurance companies. Here it is.
If an insurance company decides it's changing how it's going to structure its plan, that's not the law doing it. That's the insurance company deciding for business reasons. Yeah.
But, Doctor, the Obamacare law demands that the insurance companies change their plans.
Let's get to what happens in the individual market. First of all, I want to say the president takes very seriously, and this he said over and over when I was working for him, let's go back to what I said and make sure we're consistent with it. When we passed the law, we said any plan that existed before the date the law was passed would be grandfathered in unless lots of changes were made. Now, you know, we have to imagine Obamacare not against a blank slate, but against what insurance companies regularly do. Against what the insurance companies...
I have to ask you, does Obamacare mandate that insurance companies change their plans to meet certain standards?
Yes, it brings it up. But those, look, we grandfathered in all the pre-existing plans. If you want to change plans or you want to buy a new car, you have to meet safety standards. That was the rule.
But wait a minute. Your grandfathering is so narrow. For instance,
it's not so narrow.
Let me give you an example. For instance, if an insurance company changes the copay by more than $5 over the course of the 3 years since 2010, it's no longer grandfathered in.
That's usually a 25% change. That's a big change. You have
a $5 change in the copay. Now it's not grandfathered.
You have to ask the question, how many planks do you change in a boat before it's a different boat? And that's the same thing here. We had a plan. We argued about it. We tried to come up with...
You didn't tell the American people.
We tried to come up with a... No, we did. We grandfathered in the plans, and we tried to come up with a...
You said, now, if this plan is in effect until March of 2010, you can keep it.
That's what it says. It says grandfathered...
Mr. Capretta?
Grandfathered plans were allowed, and if they changed it
I didn't hear the president mention the word grandfather in those pledges.
That's how we fulfilled his pledge. He made that pledge before.
People who knew the law as it was being written knew the president wasn't telling the truth. The grandfather provision written into the law itself was too narrow, and frankly, they wrote a regulation intentionally trying to get people out of the individual market. Look, they want the people to go into the exchanges because there's a lot of people in the individual market. The whole point of the exchanges is to close down the individual insurance market over time.
The insurance company,
they wanted to move millions of people into the exchanges.
Insurance companies Insurance companies don't like the individual market as it's constructed. They see the future. That individual market is going away. They don't want to invest in it.
But that's not what the president said.
Let me finish.
The president said you could keep your plan.
No, the insurance companies are making that choice, not the president. The law does not require that.
Maybe I'll stop calling you gentlemen because I'm not sure. This raises a bigger question, which is who gets to decide? You say, well, we improved the policies, right, with the Obamacare coverage mandates. Who gets to decide what's a good policy or not? Our colleague John Roberts did a story, did a story about a woman named Betsy Tatter who is losing her policy. Let's take a quick look at that.
I was very happy with my plan. But then I got the letter saying that it was no longer available and I would need to choose a new one.
To replace the coverage she has, her premiums would go up from $454 a month to $871. Her options on the Obamacare website weren't any better.
The deductible with that plan is $12,700. I can't afford a deductible of $12,700.
Dr. Emanuel, simple question. Why does Betsy Tatter need you or President Obama telling her what insurance she needs?
For two reasons. First of all, if she goes in and that insurance doesn't cover enough, and which is typically what happens with these very low-cost plans, and she gets sick and it exceeds, typically we who are insured pay the difference. That's called cost shifting.
She likes her plan.
But we're cost shifting. The second thing is, just as we have safety standards for cars, you can't buy a car without a seatbelt, you can't buy a car without a airbag. You can drive them. We're not going to take you off the road. But if you're going to buy a new car, you have to have those safety features.
Okay, but let me ask you. All right,
it's the same thing with Obamacare.
Wait.
You cannot have these
I agree with you about I'll agree with you about the airbags, and I'll agree with you the safety belts. She is a woman who has a 24-year-old son. She's not going to have any more children. Obamacare includes maternity services, pediatric services, substance abuse services. That's not the airbag.
It is the airbag.
Not for her, it isn't. She's not going to need a maternity services.
We all share in the cost so that everyone can get it. She will need another high-cost service, like cancer care, or like a stroke care, God forbid, or her kid might get hit by a car, or her kid might father a baby. We have to make sure that people are covered for those things.
Whether they want to be covered for the things or not.
If they don't want to be covered, and they don't end up, and they're uninsured or they have very low insurance, they transfer those costs to the rest of us. That's the whole point of part of Obamacare, to eliminate this cost shifting, so people assume individual responsibility. When you have a low cost,
I get your point.
When you have a low cost plan, you're shifting costs to everyone else.
There's lots of insurance plans out there today that are covering hospitalization, doctor services, drugs. They're in the individual market. They're regulated by the states. They don't need the federal government telling them what they need to get. Many people
remember the individual.
Let him finish, please.
Remember,
they have high deductible plans they're perfectly happy with. You're going to hear stories all over the country of people who got just perfectly fine coverage today. They're going to lose it. That's why they're bad.
Wait a second. The individual market before Obamacare, insurance companies could throw you off when you got a disease. Insurance companies could wrap up your... Yes, that's the comparison. That is the comparison.
We're talking about
Dr. Emanuel, please.
Let me finish.
No, I asked him a question. Let him finish.
What's the individual market before the insurance companies?
Mr. Capretta, don't talk while he's interrupting. Mr. Capretta, the White House response to all this is, look, we're just talking about the individual market. We're just talking about 5% of Americans. Here's how it was explained by Jay Carney.
The universe you're talking about here is 5%. That's the whole individual insurance market, 5% of the population.
First of all, that 5% represents 15 million people. I mean, the whole Obamacare is to get 30 million uninsured insured, and that's the holy grail, but 15 million is only. Secondly, is it just the individual market that's going to lose their policies?
No. Small business plans are also being forced under the new regulations to pool their workers with a larger pool of other small business workers. So if they buy in the fully insured market in the states, regulated by the states, their insurance rates can go up quite a bit. They're going to lose their plans. Lots of small businesses are being faced with this right now and are dropping their coverage, maybe to go into the insurance exchange.
Dr. Emanuel, it isn't just small business or the individuals. There are, forgive me, sir, there are big companies, Time Warner, IBM, Sears, Walmart, or Kmart, Walgreens, that are all saying they're going to take people off their coverage and put them into exchanges. None of them are going to be able, of those people are going to be able to keep their current policies.
Those are companies making decisions on how they want to insure people. Remember,
because of the way Obamacare works.
Before Obamacare, those companies could drop coverage at any time. Before Obamacare, companies didn't have to offer insurance to their people, and many didn't. As we know, we have 50 million uninsured people, so plenty of people, and most of those are workers, by the way, who didn't have coverage.
Simple question.
So before wait a second. Before Obamacare, we were having
are those people going to be able to keep their coverage as the president promised?
The president, look, the law does not say Sears drop coverage. Sears decides what's good for Sears. The law doesn't say to the insurance industry, you drop coverage. The insurance industry decides how it's going to make money. When the private companies decide that they're going to drop people or put them in the exchange, you blame President Obama. He is not responsible for that.
Mr. Capretta.
He is responsible for this. They set up incentives that penalize companies with a very large fine if they don't have insurance that complies with the Obamacare standards. So they pay a big penalty if their workers are getting inadequate coverage.
If you're
they put
under
them into
50, you pay no penalty, and if you're over 50, it's $2,000. It's not a big penalty.
Large incentives in the healthcare law. They're forcing companies and encouraging companies to do exactly what they're doing. This was not accidental.
Right.
It was intentional.
Under 50, there's no penalty whatsoever, and you don't have to offer insurance.
I want to get into one last area here. Thank you. One of the problems so far is that many more people are signing up for Medicaid than are signing up into the private insurance plans in the marketplace. Let's put up some of these numbers, which are astonishing. These are the latest numbers out this week. In Maryland, 82,000 people have signed up for Medicaid, 3,000 for private plans. In Oregon, 62,000 for Medicaid, and believe it or not, this was the number that came out this week, 0 for private insurance. Mr. Capretta, explain why that is significant and how it could lead to what folks like you call the death spiral for Obamacare.
What's happening is these people who go onto the website and actually enter their personal income information, if it's low enough, they automatically sign them up for Medicaid. They just put them in the Medicaid program. There's no premium, so it's very easy. They say, your income's very low, you're on Medicaid. On the other people have to pay private insurance. They actually owe a premium. So if anyone goes on, actually can make it through the website, figure out what's going on, they find out, hey, I might owe $100 a month for a premium.
And the coverage is very... death spiral is the impact this could have if you have people that either don't sign up or are in something like Medicaid and therefore aren't paying into the system.
Look, the system will never work unless there are at least 5 to 7 million people in the private side of this exchange, not the Medicaid side. They are nowhere near that. They're a dead stop zero at this point. They haven't signed up hardly anybody. So they're going to have a huge undertaking to try to sign up several million people just from December 1 to February 15.
We've got some agreement here. We're both agreed that you need to sign up 5 to 7 million people in the private market for it to be viable. That's the first thing. The second thing is you would expect at this stage of the game, from everything we know about the exchanges, that not a lot of people would sign up. That's why I called for it's got to be fixed by November 30th, because at that point, people are going to begin buying. We have all the way until March 31st to get 5 to 7 million people, and we would expect naturally, I don't pay attention to those numbers, by the way, because we would expect naturally people will put off buying. Wait, let me finish. No, people will put off buying until the end, and therefore those numbers are irrelevant.
I have gotten your point, Dr. Emanuel. Here's the question, though. You also agree that if they don't sign up, and I agree, this is early, but if they don't sign up, that you agree that it's going to be very bad for the system, that in fact the premiums are going to go up if the young, healthy people don't sign up. You said this in an article.
Look, I agree with that point. There is a potential death spiral if we don't get enough people signed up. But by the way, it's not in just 6 months. We have a couple of years to get this thing up and running and working. And my firm belief, and everything we know from Massachusetts, is that we will get those people. When you have very good rates like you have in California, $50 for a 30-year-old.
We got it. Here's the last question. With all the problems with the website, more than a dozen Senate Democrats, not Republicans, Democrats, are now saying put off the penalties. Even delay, in one case, Manchin is saying delay the entire individual mandate a year. And we heard this week from Max Baucus, the senator who helped write Obamacare. Here he is.
Maybe we should start thinking about delaying the penalties. But it's not right to penalize people for mistakes that the government's made because the exchange isn't working.
Should the penalties be delayed beyond March 31st?
No, they should not be delayed beyond March 31st. If the website's working by November 30th, people then will have a full 4 months to sign up, and that's no reason to delay them. And I don't think you can prejudge now. And if it's working adequately by November 30th, that's a whole new question. But it's way premature to talk about it. I think it's going to be up and running by November 30th. And then, if it's not, we can have a renewed debate. But to call for it now, 30 days before it's even debuted, I think is a mistake.